cardiovascular pharmacology, other antiarrhythmics. All right, so lastly, we just have a couple antiarrhythmics that you need to know. First one is going to be adenosine. Adenosine, all that it does is that it increases potassium out of the cells, okay? So it pushes potassium out of cells, okay? And it also leads to a decrease in the calcium inflow of cells, okay? So very important. So it pushes potassium out of the cell and it decreases the inflow of calcium into the cell, okay? And that leads to a decreasing of the AV nodal conduction pathway, okay? Now, adenosine is your number one usage, okay? The number one thing that they use it for is going to be terminating the certain forms of SVT, okay, which is supraventricular tachycardias, okay? It's a drug of choice in terminating or stopping the different forms of SVT, supraventricular tachycardias, okay? It's very short acting, okay? And what you need to know is that the adverse effects include flushing, hypotension, chest pain, and a sense of impending doom with bronchospasm. Okay, so weird, but the patients feel like they're dying. All right, when you give them like a bolus of adenosine, it's just like a quick acting thing. It literally just like stops their heart essentially, and like they get this sense of impending doom. And they will say sometimes in the question stem, they will say like they have severe chest tightness and they're like freaking out. Okay, and the answer is adenosine. Okay. Lastly, if you give a patient adenosine and they're on theophylline or caffeine, those block adenosine receptors. So you're not going to have any effects of adenosine on the human body if the patient's already taking theophylline or caffeine, all right? Caffeine being like the thing that you drink like through coffee. So I know it sounds weird when I'm saying it like next to theophylline, but I'm just talking about like actual caffeine. And then lastly, magnesium. Magnesium is very effective against torsades de pointe. So we're going to treat torsades while giving magnesium, which is very important. But yeah, that's pretty much it. That's all you have to know. Adenosine is somewhat important to know, so be aware of it.